everyone, I'm Dr. Ritakshi. Welcome back to my channel. Today I'll be discussing about chronic kidney disease, risk factors, and how diet plays a big role in preventing or slowing down the progression of kidney disease. Chronic kidney disease is a condition where the kidneys fail to filter the blood and remove waste products, which leads to buildup of toxins in our body. Chronic kidney disease is a progressive disease, and it will eventually lead to end-stage renal disease, which will require dialysis or kidney transplant. Since chronic kidney disease is a progressive disease, it's important for us to realize and know the risk factors so that we can prevent it from developing. And it's also important for us to be diagnosed with it early stage so that we can slow down the progress of it and lead to complete failure of our kidneys. The risk factors associated with chronic kidney disease are diabetes, hypertension, obesity, cardiovascular diseases, smoking, family history of kidney disease. So the leading cause of chronic kidney disease is diabetes and hypertension. So it's very important that while we are treating chronic kidney disease, we must manage our diabetes and our hypertension. So we must take proper treatment for these two so that our kidneys can function properly. Let's go through some signs and symptoms of chronic kidney disease. Now, in chronic kidney disease, we can sometimes find swelling of our feet and ankle. There's shortness of breath. There's fatigue or tiredness. We can have changes in our urination, the frequency or the color of our urine. There's also sometimes vomiting, nausea feeling. So in defining chronic kidney disease, we usually look at GFR, the values of glomerular filtration rate. So GFR is a measure of how well our kidneys are filtering the blood. Usually a GFR of less than 60 milliliters per minute is an indication of CKD. Now this usually means that it's not filtering all the waste products and protein in our body, and we usually find buildup of toxins in our body. CKD progresses, the GFR decreases, and this means that there's a lot of waste built up in our body. Now CKD has 5 stages: CKD 1, 2, 3, 4, and 5, and usually you will notice that the GFR in each level is decreasing. Another indicator of kidney function is albumin, a protein that is usually filtered by our kidneys. If there is presence of albumin in our urine, that means that our kidneys are not functioning properly. Fortunately, there is steps that can be taken to prevent CKD or to slow down the progression of chronic kidney disease. The first one being that we should have modifications in our diet and in our lifestyle. So a general kidney-friendly diet is usually low in protein, sodium, phosphorus, potassium, and it's high in fruits and vegetables. But what we should remember is that since the leading cause of chronic kidney disease is diabetes and hypertension and obesity and all this, we must first control these factors as well. So we must control our diabetes. We must have a diet that is appropriate for your heart. Let's now take a closer look at some nutrients that can help us manage our chronic kidney disease and how much of these nutrients we should be consuming. So first is protein. Now protein is an essential nutrient that is vital in building and repairing our tissues of the body, and they're a very good source of energy for us, and they maintain all our body functions. So restricting protein or decreasing and limiting the amount of protein in your diet can actually be helpful for you if you have chronic kidney disease. So restriction of protein can actually delay the progress of your kidney disease, and it will also delay your need of going on dialysis. So the recommended intake of protein usually is between 0.6 grams to 0.8 grams per kilogram of your body weight per day. So that would be around 60 grams to 80 grams of protein per day. Good sources of low protein foods would include lean meats like grilled fish, grilled chicken. You can have eggs, and a plant-based diet is also very helpful. And also this is a good diet if you have a diabetic kidney disease. Now, if you're already on dialysis or if you have end-stage renal disease, then you do not need to restrict your protein intake. However, it's important to consult with your doctor or your dietitian to know exactly how much protein requirement is needed for you at that stage of your chronic kidney disease. Second is low salt intake. Now, people who have chronic kidney disease should limit the amount of salt or sodium that they're having each day. So the recommendations are that you should not have more than 2000 milligrams of sodium per day, but not less than 1500 milligrams of sodium per day. So as we limit the sodium intake in our diet, this will also eventually lead to lowering down your blood pressure. It will prevent high blood pressure or hypertension. So as we mentioned before, hypertension is one of the leading causes of chronic kidney disease. So it's better to manage your hypertension and lower your blood pressure level. So good sources of low sodium foods would include fresh fruits and vegetables, whole grains, and lean meats. Now, when we are buying food from outside, always make sure that you read the labels, the nutrition facts, and see how much sodium it contains. Then you can add all that up and make sure it's not more than 2000 milligrams of sodium per day. Now, you should also try to avoid processed foods as much as possible, and you should also not use table salt and just put it on your food for the taste of it. Make sure that you're avoiding this behavior and this habit of yours that you just need to add salt in everything you eat. Third nutrient is phosphorus. Now, phosphorus is a mineral that's useful for us, and along with calcium, it helps to give us healthy bones. Now, when our kidneys are working properly, excess of phosphorus is usually filtered out. But when we have chronic kidney disease, there is accumulation of phosphorus in our body because the kidneys are not able to filter the excess of it. In case of high levels of phosphorus in our body, can eventually lead or cause high levels of PTH, a hormone, parathyroid hormone. And this can lead to weakening of our bones and bone fractures. Now, phosphorus can also accumulate itself in blood vessels and can accumulate in lungs. The recommended daily intake of phosphorus in patients with CKD 3, 4, or 5 or GFR less than 60 ml per minute is somewhere between 800 milligrams to 1000 milligrams per day. So we should avoid foods that are high in phosphorus, especially inorganic phosphorus, like these could be found in milk, cheese, chocolates, processed foods, packaged foods, and also sometimes we should limit the intake of nuts and seeds. Fourth is potassium. Now, potassium is an important nutrient that helps us maintain our blood pressure, heart rate, nerve, and muscle functions. So of course, in healthy kidneys are usually responsible for maintaining a good balance of your potassium levels. But when you have chronic kidney disease, your kidneys are not functioning properly. There is accumulation of potassium in your body and there are high levels of potassium. If you have very high levels of potassium in your blood, this leads to hyperkalemia. And this usually can cause complications such as irregular rhythms or arrhythmias of your heart. Therefore, it's very important for kidney patients or with kidney disease to have a diet that is low in potassium, or they should limit high potassium foods. So what are some of high potassium foods that we should limit? Now, these include bananas, tomatoes, spinach, broccoli, and even avocados. Last but not least, water intake. Now, in patients with chronic kidney disease, you need adequate amount of fluid in your body because most of kidney patients end up being dehydrated, and this is not good for their progression of chronic kidney disease. The right amount of water or fluid intake is required to slow down the progress of kidney disease. So fluid intake should be individualized based on how much of your urine output is, what are the medications that you're taking, and what are the activities that you perform during the day. But staying hydrated is very important in chronic kidney disease. Now, in addition to these nutrients that we have just discussed and how much we should consume them, it's also very important and necessary to have enough calories to consume per day. And also you must include some healthy fats to maintain your health and energy levels throughout the day. So in addition to these diet modifications and having a healthy diet to treat or manage progression of chronic kidney disease, it's also very important to find the underlying cause and treat those, such as diabetes and hypertension and obesity. Sometimes some diets, such as ketogenic diets or low carbohydrate diets, have also been proven to help with treatments or slow progression of chronic kidney disease. Now, you should really consult your doctor or your nutritionist or dietitian to discuss specific diets for your needs and your level of CKD. So we must remember that prevention is the key to deal with CKD. So to prevent it or even to slow down the progression of CKD. Now, it's important to, if you have any risk factors or any underlying cause, then you should consult your doctor and you should get yourself tested. And prevention is usually by managing your weight, managing a healthy lifestyle, avoid drinking, avoid smoking. You should treat diabetes and hypertension if you have them, lower your blood pressure, and you should exercise regularly. In conclusion, we know that CKD is a serious condition that leads to long-term health problems, so it's better to prevent it or to slow down the progress of chronic kidney disease. So this can be done by following a healthy lifestyle and having a kidney-friendly diet. Having a kidney-friendly diet that has adequate amount of protein, low in sodium, low in phosphorus, low in potassium, and having adequate amount of water. And along with these, having a healthy lifestyle where you're exercising regularly and avoid smoking and drinking. These will all help in slowing down the progress of kidney disease. And if you don't have kidney disease, then these are all good for you to prevent from having kidney disease in the future. So if you have been diagnosed with chronic kidney disease, then it's necessary for you to monitor your kidney function tests and your GFR levels, and always be in contact with your physician and be under supervision of theirs, and also have a nutritionist or dietitian plan your diet for you and follow what they are asking you to, and also take the medications that are needed to treat your chronic kidney disease. This was all about chronic kidney disease and kidney-friendly diet that we can follow, but always make sure that you have a personalized plan from your doctor or your dietitian. And every individual has different needs and requirements in their body. And so this is just a general idea of what a kidney-friendly diet should be like, but individuals should consult their dietitians for their levels of kidney functions and the requirements. Thank you for watching this video. I hope you found it helpful, and if you did, then please like the video, share the video, and subscribe to this channel for more health related videos like this. Thank you for watching. I'll see you in the next one. Bye.